Hi, I'm Melanie Griffith, and I am a master instructor at SoulCycle, where they call me Mama Mel.
Hi, I'm Dr. Borowski, a sports medicine physician at NYU Langone Health.
The conversation around what happens to women at 40 is very loud right now, which I think is cool. I am 55 years old. I have been kind of dancing with menopause and perimenopause since I was in my early 40s because I went through chemo treatment and went into medical menopause. A lot of hot flashes. 5 years ago almost, I went into then surgical menopause. I think at the time I was trying to survive life, and over the last few years as I'm thinking about my health and my health span and my longevity and living as long as I can, I am trying to think about what's actually happening to my body and what are things I could do about it.
So many changes that happen after 40, or even starting even earlier. Changes in your sleep, changes in your hormones, changes in the distribution of fat. But there's so much talk on bone density. We've all known that bone density is a problem over the years, but I think it's just now coming into the conversation that muscle is also equally as important. And it is a natural part of aging where we lose muscle, right? So sarcopenia is a real thing. And it really starts over, the age 35 to 40 where we actually start to lose that. And so we really have to work hard on keeping what we have. And I think that, exercise in particular can really help with the changes in your stress and your anxiety and depression and these muscle issues that can come up more in the 40s.
For me, as a woman who is well into her 50s, I'm focusing on my heart, I'm focusing on the strength of my legs, the strength of my core muscles, which is anything just gonna support me being strong and tall and proud.
I would add in that grip strength is also really important, right? So that is a direct correlation to longevity. You want to be able to, it's all functional. We want to remain functional.
Can we talk about hormones?
Please. As we go through menopause, we lose estrogen, and that's what is a lot of the driver of these hormone changes, along with some other hormones. But estrogen is so important for things like bone health and your muscle and all of these things. And so if we can give women back or kind of stabilize some of those levels, you can see a decrease in a lot of the symptoms that happen. I have women come into my office every single day where they wake up, they're 45, 50 years old, they wake up and they're like, all of a sudden, everything hurts. All of their joints hurt, all of their muscles hurt. There's this concept of the musculoskeletal syndrome and menopause, so we know that there is an effect. We have not yet delineated exactly what it is yet. Myself and some of my colleagues at the Women's Center, a lot of physicians and physician scientists are really starting to look more at.
Yeah. What I would want to say to women who are 40 and aging up is good for you. Keep aging, stack the birthdays. There is nothing to be afraid of. You have already survived so much. Age is just a number. Tips that I would have for women over 40 in terms of optimal health is find something that you love to do and just go out and do it. For me, it happens to be SoulCycle, and there's so many things about SoulCycle that I love, and I have love for coming up on 20 years. Certainly the cardio benefits of it, but also the mind-body connection.
And really with the right mindset and focus on nutrition and sleep and health, with guidance from the right physician, women can feel vibrant and healthy at any age.